Gum disease is a disease of inflammation around the teeth, and we all know how harmful inflammation can be in the body. Gum disease is caused by bacteria accumulating around the teeth, and we can think of certain stages of gum disease. The first stage is called gingivitis. In gingivitis, bacteria accumulates around the teeth, and the body responds to the irritation from that bacteria with inflammation, or as we call it, gingivitis. In the next stage, left untreated, the gum starts to separate or detach from the tooth. As it detaches, it allows more bacteria and more tartar to get under the gum and get closer to the bone. In the third stage of gum disease, the disease spreads deeper from the gum and now starts to affect the bone. This disease is called periodontitis. In periodontitis, the gum is still inflamed, the gum is still detached from the tooth, but now bone destruction begins around the teeth. Left untreated, we move to stage 4. In stage 4, the gum is inflamed, the gum is detached from the tooth, the bone is destroyed, many times quite severely, and left untreated, the teeth either fall out or become abscessed and need to be extracted. Gum disease is the #1 cause of tooth loss in adults. Over the years, many patients would rather lose their teeth to gum disease rather than have cut and stitch gum surgery. I was the first periodontist on Long Island to employ the FDA Approved Procedure called LANAP, or Laser-Assisted New Attachment Procedure, which allows us to treat even the most advanced cases of periodontal disease without traditional cut and stitch periodontal surgery. The periolase laser is perhaps the biggest advance in treating periodontitis or pyorrhea in the last 50 years. Traditionally, advanced gum disease was treated with cut and stitch gum surgery. Periodontal surgery is very effective at treating periodontal disease. However, many patients find it objectionable because of the invasiveness of the procedure, the long healing period until their teeth feel normal again, and typically the amount of recession or root exposure that occurs following periodontal surgery. Treating gum disease with the periolase laser has really been a revolution in how to manage someone's gum disease. I'm proud to be the first periodontist on Long Island to offer this option to our patients, and patients are relieved to know that there's a way that they can treat their gum disease using a laser which is comfortable, which results in minimal discomfort or recession following treatment, so that they can keep their teeth. Patients have little to no discomfort after the procedure. Most people just take a Motrin or a Tylenol that we give them in our office and nothing beyond that. And by the next day, the vast majority of patients feel as if nothing had been done. They feel completely fine.